what are the indication of ponytail lift or the mid-face suspension? The indication are a patient in their 30s with little or none skin laxity and need a little bit of projection in a tiny little bit of tightening of the skin. The experience that we all gathered by doing the procedure had reduced the indication. Of course, when the technologies was first introduced, we use it in a lot more cases, but then we had seen the result based on those cases, and we had selected a smaller number of cases. Now, some surgeons use the same technique for every patient, and of course, if you have only a hammer, the entire world looks like a nail. But I can offer several type of facelift, from the ponytail, so-called mid-face suspensions, to the one stitch, to the mini, to the vertical lift. So I have a variety of procedure that I select. It's basically a custom-made decision. Now, I was one of the first one to present in the early 2000 the mid-face technique suspension, and I taught to a lot of residents, including the surgeon who actually popularized the technique right now, and he's a very talented surgeon. Now, the problem I see it in my experience is that we tend to use one technique for all the patients, which is wrong. Now, the mid-face suspension, as I said, works well for younger patients with a limited laxity of the skin. Now, remember, the beauty of doing endoscopic surgery is that you don't leave scars or small scars. In case of the ponytail lift, a scar in the temporal area, which is not visible, which that is the positive thing. Now, the negative thing is obviously that by not removing the excess skin, even in a younger patient in their 30s, have excess skin. So by not removing the excess skin, you're not, in my opinion, get long-term gain. Again, sacrificing the fact that you're not doing any incision, and that's a plus, obviously, but remember, the incision in front in the ear are actually very well tolerated by patient, and they most of the time heal with a almost invisible incision. So it's more sometimes a gimmick. So what I want you to educate yourself and distinguish what is the gimmick and what is the real deal. So remember, when I see results on social media, I don't see long-term result. Most of the results are short terms. I see 1 month, 3 months, 6 months post-op, and obviously because of the swelling, everybody looks great at 1 month, 2 months, 6 months. But the success of a procedure is in their long-term result. And in my experience, the long-term results are not rewarding. So the ponytail lift is a let's say it's a small part of the options we can deliver to each patient. It has some indications. In my opinion, it's overdone. It's used for every patient. Sometimes what is kind of a nonsense is do the ponytail lift and do a separate incision with the neck lift. And basically what happens is you have a clean neck, but the face, the skin of the face is still not tight enough. So you have create a not a very harmonic result. So that's my opinion. I get actually I have done hundreds of these mid-face ponytail suspensions. I have seen result long terms, and I can offer it in the four. I'm able to distinguish what is the best procedure for each patient. Don't fall for the gimmick again. Educate yourself. Look at a decent long-term result, not for the, don't fall for the 1 month social media classic result in which, wow, or the result in which the pre-op picture has all the markings and it makes it look like the patient is older than his age. Of course, we all post before and after picture. Sometimes I'm at fault myself with different lighting. It's not done with intention. Sometimes with doing surgery, you operate in different area in Italy and in other area of the world, and the lighting is not perfect. It's not done intentionally. Beware of surgeons. Some of the surgeons, they intentionally only show you the 1 month, 3 months, 6 months results. And I'm trying to be intellectually honest and tell you the whole thing. Again, so the bottom line is this. Endoscopic facial surgery is here to stay. The endoscopic brow lift has widespread indication, and I use it all the time. The mid-face suspension had a sort of a peak and has leveled out to a level in which the indication are limited. That is my opinion, my honest opinion. I hope you have gathered some information from this video, and please be aware again of the shortcoming of this seems very popular procedure, which is the ponytail lift. Take care.